Dr. John Torres with NBC News on his Facebook Live. Dr. John Torres with NBC News. Dr. John, giving you an update on what's happening with President Trump, and particularly the fact that he tested positive for COVID-19. In case you hadn't heard that news, I'm going to walk you through the timeline and an understanding of kind of what's gone on and what it means for him going forward and what it means for all of us. But first start off with President Trump and First Lady Melania Trump have both tested positive for COVID-19. Now, a couple of days ago, they had been exposed to COVID-19, and so they were putting themselves in quarantine, and they sent out some tweets saying, we're in quarantine, we're being safe. Well, then they subsequently tested positive. So let me give a bit of rundown here. Number one, First Lady Trump, Melania Trump, actually has said that she's got some symptoms, but she feels okay, and she's hoping for a speedy recovery, that she's doing fine. She did test positive for coronavirus. So did her husband, President Trump. And here's what initially happened. So they've been traveling on the campaign trail. A few nights ago, they had the debate with Vice President Biden. At the time, Hope Hicks, who's one of President Trump's closest advisors, had tested negative that morning. It was Tuesday. Wednesday, they went ahead. They tested negative Tuesday. Wednesday, they tested negative again. But then Wednesday evening, she started getting symptoms. And that's when they went ahead and retested her. She tested positive for coronavirus. And so Thursday, that's when President Trump sent out the message saying, hey, we've been exposed to somebody who's positive for COVID-19. We're in quarantine ourselves. That was Thursday evening. And then Friday morning, this morning, they actually came up saying, hey, now we're starting to get symptoms. And a few differences here, and I'll explain a little bit of what's going on. But first and foremost, number one, President Trump is positive for COVID-19. He also has the virus SARS-CoV-2. To explain just a little bit of the difference between the two, SARS-CoV-2 is the virus that causes the disease COVID-19. Now that he's tested positive for COVID-19, he has the disease as well as the virus that's causing it. What he needs to do here is isolate himself until he is through that isolation period. And I'll talk about that in a second as well. Again, looking at the timeline, typically what happens is when somebody tests positive for COVID-19, if you go back 2 or 3 days, that's when they start being contagious. And so he tested positive for COVID-19 last night, Thursday night. So if you go back 2 or 3 days, we're talking Monday, Tuesday time frame when he was contagious. That was the time of the debate. So the big question is, was he contagious at the debate? Could he have spread it to other people? The answer is probably, and yes, he probably could have spread it to other people, but they're also doing a lot of social distancing and taking appropriate measures for the most part, especially Vice President Biden and the Democratic Party. The Republican Party tends to shy away a bit from masks, and so they weren't wearing them as much. And that probably has something to do with the fact that not only President Trump, not only First Lady Melania Trump, but some of the other advisors are starting to test positive as well. And they're testing everybody throughout the administration at this point that has come in contact with either President Trump, First Lady Melania, or with Hope Hicks at this point. And they're quarantining them to a certain extent. And I'll explain what that means in a minute too. And I know I'm delaying these explanations, but it'll come to make sense here. Now, with President Trump, the issue comes in with quarantine. What does he need to do at this point? Well, first off, a difference between quarantine and isolation. So those that are around him, that have been exposed to him, now that he's positive for COVID-19, they need to quarantine for 14 days. The reason they need to do that is because this virus's incubation period is 2 to 14 days. And so if they don't quarantine for 14 days, if they only stay quarantined for 7 days, then there's a 7-day period where they could possibly pass it on to somebody else. And if you remember, up to 40% of people with coronavirus don't even have symptoms. They don't know they have it, and so they could be spreading it to others without having those symptoms. So they need to quarantine themselves. But here's what might be happening, because we are seeing his chief of staff was on the lawn of the White House today talking to reporters, was not quarantined. Other members have not been quarantined either. Here's possibly what could be happening. According to the CDC, again, if you're exposed to coronavirus, if you're exposed to somebody who's positive for COVID-19, and what that means, if you're exposed to them 2 or 3 days before they became positive, then you should quarantine for 14 days, meaning you should stay away from the vast majority of people. Stay in your house. You can be with your family, but stay in your house and keep away from other people. Don't go out and about. However, and what they mean by exposure is that if you were within 6 feet of somebody for 15 minutes total, then that's considered an exposure, but so too is physical contact. If you were hugging somebody, that can be an exposure as well. And if you think about the campaign trail, there's a lot of handshaking, hugging, those types of things going on. And even now in the pandemic, when we shouldn't be doing much of that, that's still happening to a certain extent. So if they were involved in that type of situation, then they should quarantine. However, last month the CDC came out with some changes, and what they said is if you're a critical worker, then you don't need to quarantine that way. There's different measures you can take, even though we're letting you go back to work. So are they critical workers? It's up for interpretation, but it does certainly say that government workers could be classified as critical workers. These are workers who are needed to keep the infrastructure of the nation going. If you're a critical worker, what they're saying is you can go back to work, but there's a few steps you need to take. Number one, you need to be pre-tested. And by pre-testing, the CDC says taking your temperature, making sure you don't have a fever, looking out for symptoms. Pre-testing could also be the tests that they're taking, the nasal swabs, to find out if they have it. And administration gets them every day for the most part. On top of that, you need to monitor yourself. If you have symptoms, let somebody know. Put yourself in quarantine. You also need to social distance. You need to wear masks. You need to go ahead and clean your environment. So if you're at a podium or some other area, clean it before you leave. Now, if you look at President Trump's and his administration, they are doing those things, especially for the ones that are out here. They're out and about still, but they're not wearing the masks. And that's the one fallback here. They need to kind of ramp that up a little bit to protect themselves and to protect everybody else around them. And so that's the staff members who might have been exposed. Now, as for President Trump, the isolation period, here's what the CDC says. If you're exposed to COVID-19 and you test positive, if you test positive for COVID-19, then you need to isolate yourself. And that means keep away from everybody for 10 days. If you have no symptoms, 10 days is when you need to stay away from everybody else. However, if during that 10-day period you start having symptoms, then that's when the clock starts on the 10-day period. So then you move the 10-day period up, and you have to go 10 days from when the symptoms start. However, at the end of that, if you've had symptoms, 10 days is a minimum. You need to make sure that your symptoms are improving, and also that you've been fever-free for 24 hours. And then the CDC says you're no longer contagious, you don't have to be in isolation. So in President Trump's situation here, he was first exposed, or Hope Hicks found out October 1st is when he was exposed. I'm sorry, October 1st is when he was diagnosed with COVID-19 because of his test. And so that starts the 10-day period. But October 2nd, he started symptoms, so the 10-day period moves to there, and so now he has to go through October 12th. After October 12th, so on the 13th, that's when he is no longer considered contagious, assuming his symptoms get under control, they start getting better, and he's fever-free for 24 hours. Up until then, he needs to be in isolation. That means no going out and about, no being around other people, even with masks or anything else like that. So, again, that's where we are with him right now. But what does this mean for him going forward, and what kind of issues does he possibly have? Well, a couple of things. The things that put people at a higher risk of having complications for COVID-19 are a couple that impact him. One, age. 65 and above, you're at higher complications. And that's mostly because once we start getting to 65, our immune system isn't as strong as it was when we were younger. And what happens there are a couple different things. One is our immune system can't attack the coronavirus and fight it off as easily. So it can take a hold. Once it starts taking hold and the immune system does start kicking in, then it can have some problems at that point of not being able to control itself and going essentially into overdrive and causing things like the cytokine storm that people have probably heard about, where the immune system's attacking the body. So that's the age. The other factor is obesity. 4 months ago, President Trump had a physical. He was 244 pounds and 6'3". If you run a BMI calculator on him, that is a BMI of 30.5. Obesity is considered 30 and above, so he's in the obesity category. And granted, he's at the low end of that, but he's still in the obesity category. And that causes problems as well, and more possible complications with coronavirus for a few reasons. One, because of the weight, you have less lung function. And remember, this is a respiratory virus. Number two, your immune system doesn't work as well if you're obese. And number three, you're also more prone to blood clotting. And so those three things could cause more complications with coronavirus. So he needs to be looked at very carefully. And he's gone from no symptoms to mild symptoms on day 2, and hopefully doesn't progress much beyond that. The vast majority of people do fine on coronavirus, but people that do have complications can have serious complications, and that can cause big issues. Now, on top of that, he might be getting therapeutics or about to get therapeutics, especially if his symptoms start worsening. Now, the therapeutics in particular, remdesivir is probably the main one they're looking at giving. That's an antiviral. The earlier you give it, the better. And what this has done, what we've seen in studies, is it can cut down on the symptoms. It can make them more mild. And it can also cut down on the time of the disease. Number 2, convalescent plasma. That's been showing some benefit as well. He might be getting convalescent plasma. Probably not at this point, but if he starts getting worse. And then the other one are the steroids, especially dexamethasone. Steroids would not be appropriate at this point because those are reserved for if he turns critical ill, for people who are critically ill from coronavirus, because it can tampen down the immune system and stop that cytokine storm. But because it affects the immune system, we don't want to give it to people early because that could cause problems when the immune system is trying to fight off coronavirus. So he wouldn't be getting that at this point. So he might be getting remdesivir. He might be in line to get convalescent plasma at some point, and possibly even monoclonal antibodies. Those are right now used in clinical trials or being looked at for clinical trials, and so it's possible that he could be getting that as well. But currently what we've heard is, again, that he has mild symptoms. He actually tested positive yesterday. Today started having mild symptoms. He is in isolation, and the goal is to keep him in isolation until his symptoms get better under control, at least that 10-day period. He's fever-free for 24 hours, and then possibly could come out of isolation at that point. Now, if you think about the date, that's October 13th. Campaigning is going to go on. 15th is the next scheduled debate. That is still possible. We'll have to see what happens as time goes on here, and what happens with his symptoms and his disease. But I know we're all hoping that he improves, him and both the First Lady Melania Trump, Hope Hicks, anybody with COVID-19 improves, and so hopefully he does at that point. But I just wanted to give you a little understanding of what's going on with him right now, how he's gotten to this point, and what that means for him going forward. Now, as far as for the people he's around, contact tracing is an important element of this. That contact tracing is going to be easy with the administration and those working around it because they know who's around them. The Secret Service, the attendants on the airplane, his administration, they have a good understanding of who those people are. Contact tracing is going to be a little tougher for those that might have been at rallies, especially if he was hugging any of them, especially if he was close to any of them for long periods of time. That could cause an issue. And I think looking forward, hopefully one of the biggest things is, number one, that he does get better, but also number two, that he gets a personal understanding of coronavirus and the impact it can have, and can use that going forward to hopefully help the country through this pandemic and help us get through it a little quicker and a little easier on everybody else. So I don't know if anybody has any questions here, or so at this point I think the main thing is just to kind of keep an eye on his symptoms and what's going on here with his symptoms over the next few days. Usually the first 4 to 5 days is a time period that we start looking to see if their symptoms are going to worsen. Once they get beyond that point, they seem to be doing better. But also you have to remember that it's possible that he could have long-term symptoms. Some people, what they call the long haulers, are people who typically have coronavirus symptoms. They get better, and then weeks later, months later, they start having other symptoms. And as we've talked about, coronavirus symptoms could be anything from chest pain, shortness of breath, fevers, cough, hair falling out, loss of sense of smell, abdominal pain, neurological findings, muscle weakness. I mean, the list goes on. And so we don't know what his symptoms are, but what we're being told is they're mild symptoms. And so hopefully they stay that way. And again, hopefully he, the First Lady, Hope Hicks, and anybody with coronavirus recovers. But hopefully this has been a bit informative. And as always, I hope you stay as best you can, happy and healthy. Thanks.